Today I shall be going into the method of examination of a patient with a stoma. This is a good question for a short case in clinical or an OSC case. And I think students must be quite familiar of what to do in examining a patient with a stoma. Introduction to the patient. Wash your hands carefully. Introduce yourself to the patient. Confirm the patient's identity. Briefly explain in patient-friendly language what the examination is going to be all about. Gain the confidence and the consent to proceed with further examination. Adequately expose the patient's abdomen and position the patient. The ideal position is reclined as shown here. Inquire if the patient had any recent problem with the stoma. And last but not least, reassure the patient that the procedure or the examination that you're going to perform is not going to cause any hurt or pain. Next, you assess the stoma. Okay, this you can be done by inspection, inspecting the stoma for the site, the number of lumens, presence or absence of spout, and the contents of the effluent. Okay, the site, different types of stomas are typically located in specific sites on the abdomen. Colostomies are usually in the left ileal fossa. Ileostomies and urostomies are typically in the right ileal fossa. Then look at the number of lumens, single or double. This can help you to give clues when trying to determine the subtype of the stoma. One lumen can be located in the RIF is an N ileostomy or urostomy. One lumen located in the left ileal fossa is an N colostomy. Two lumens located together in the right ileal fossa is a loop ileostomy, and two lumens close together located in the LIF is a loop colostomy. Okay, then you look at the spout, whether they're present or not present, to differentiate between ileostomies, urostomies, and colostomies. Sprout present, it's either an ileostomy or a urostomy. Sprout absent, it is most likely a colostomy. Then the nature of the effluents. Colostomies tend to produce semi-solid fecal effluents, whereas the ileostomies produce liquid fecal effluent. Urostomies produce urine. Then have a careful look, closer look at the skin surrounding the stoma. Inspect for the evidence of erythema, tissue breakdown, and of fistulation. We also look for parastomal hernia, which are quite common. Parastomal hernias is a type of incisional hernia in which the abdominal contents produces through the abdominal wall defect related to the stoma. Clinical features of parastomal hernia include enlargement of the stoma, bulging of an area surrounding the stoma, increased size of the hernia when coughing and sneezing. It is reducible, normally it's reducible, and in rare cases, a loop of bowel can become trapped and get strangulated. Then look for the complications of stoma. Stomal infarction is a very important complication that must be detected, usually occurs in the immediate post-op period within the first few days. So in the first few days, a careful inspection must be done to make sure there's no stomal infarction. Stomal prolapse is another complication that results in stoma appearing longer than normal. The stoma length may increase when the patient coughs or strains, and normalizes when the patient is lying down. If the stoma remains prolapsed for a long period of time, venous drainage can be impaired, resulting in venous congestion and secondary ischemia. Stomal retraction is another complication which can occur even after a long time. Involve the stoma sinking below the level of the skin. A retracted stoma has a concave, bowl-shaped appearance, and the retraction causes poor stomal back attachment, leading to frequent periostal skin complication as described above. Stomal hemorrhage, usually they are minor bleeding due to trauma attained during the changing of bag. But if the bleeding is more significant bleeding from the mucocutaneous junction, then urgent medical help should be sought. You mustn't forget that stomal bleeding may also indicate pathology within the GI tract, such as malignancy. And in concluding the examination, you have to summarize what you got from the patient. And this is a typical summary which you can, example of a typical summary which you can use it for your purpose. Okay. We come to the end of the talk. I just show you some pictures of parastomal hernia, and this is a protective or a belt, abdominal belt, waist belt, which can be used in treating or controlling parastomal hernias. Where this hole here is where it is placed around the stoma. This is a large parastomal hernia. This is a moderate size parastomal hernia, and this is a small one.
Okay, next we come to a short clinical case discussion. The 65-year-old man, a 65-year-old male patient presents with a history of colorectal cancer. He underwent a surgical procedure to remove the tumor, which resulted in the changes as shown in the picture on the right. Describe what you see in the picture. What does the picture show, and what is the operation that was done for the patient? The answer is stoma at the left iliac fossa, and the operation done was to create the creation of a colostomy. Question number 2. The patient has been living with the colostomy for the past 6 months. He reports occasional discomfort around the stoma site and has experienced some skin irritation around it. The patient is concerned about managing his colostomy and is seeking advice on proper care and potential complications. Okay, the answer to this will be proper care of the stoma, cleansing or cleaning the stoma every day as frequently as possible, especially after a bowel movement. Drying the area to keep the area around the colostomy as dry as possible all the while. Third, changing the colostomy bag. Change the colostomy bag in 2 to 3 days or whenever it is 2/3 full. Fourth, inspecting the skin, looking for signs of irritation or dermatitis, redness and pain, itchiness. So these are important things that you must look for, and if you have, then consult the healthcare supporters for more further treatment. And using of adhesive products, okay, those adhesive products which are provided with the colostomy bag, and this will avoid leaks and thereby reduce the complications. Then managing of diet, regular balanced diet, make sure you use to a proper diet where the stools are well formed, and to avoid diarrhea and further irritation of the skin around, and seeking support of the healthcare and support groups whenever you need that. The second question, what are the complications of the stoma? Okay, the skin irritation, parastomal hernia, stoma infarction, okay, and the stoma becomes gangrenous, stoma prolapse, stoma retraction, and stoma hemorrhage. These are some of the common complications of stoma. Now we go to some multiple choice questions. Question number 1. What is the primary purpose of a colostomy? To remove the colon, to divert fecal matter from the colon, to treat skin irritation, to cure colorectal cancer. So the right answer is B, to divert fecal matter from the colon to the outside. Question number 2. Which of the following is a common complication associated with colostomies? Increased appetite, skin irritation around the stoma site, improved digestion, and weight gain. The right answer is B, skin irritation around the stoma site. Okay, is the most common complication. Question 3. What advice should be given to a patient with a colostomy to prevent skin irritation? A. Avoid cleaning the stoma site. Use adhesive products around the stoma. Keep the stoma site dry and clean, and apply heavy moisturizers. The answer is C. Keep the stoma site dry and clean. Question number 4. How often should a colostomy bag be changed? A. Once a month. B. Once a week. Every 2 to 3 days. Only when the colostomy bag is full. The answer is C. Every 2 to 3 days, or when it is 2/3 full. Question 5. What is the most important aspect of colostomy care? Regular exercise, proper nutrition, maintaining hygiene around the stoma site, and frequent medical checkups. The answer is C. Maintaining hygiene around the stoma site. Okay, thank you for joining me for this session on examination of a stoma. Hope to see you again in another session.